So I'm going to start with a welcome to looking good and feeling good through 100, vitality, strength, beauty, and great sex at any age. So I'm going to start with just an excerpt from a blog by Grant Cardone, author of Be Obsessed or Be Average. Goals aren't a New Year's resolution or a journal entry or a bumper sticker. They are critical to your life's happiness and fulfillment. Don't write goals down on a Post-it note and look at them once in a while. Eat, sleep, and breathe your goals. Not just because you should, but because you can't not. Feed the beast so that it becomes so powerful there's no room for doubt. Because the moment you divert focus from your goals or take your eyes off them, you get lost in all the noise of your mind. So in healthy aging, at all ages, we need to be proactive. We can't be passive. We don't want to just live to 100. We want to be vital. We want to have the best quality of life. So I'm going to take you through what you can do for yourself through nutrition, sleep, exercise, meditation, and yoga, and then what we at Kaplan Center can do for you. IV vitamins, IV NAD, hormones, O-shot, and facial rejuvenation through acupuncture. Let's just start with the basics. Start with diet. So many different diets: paleo, Mediterranean, vegan, plant-based, keto, modified keto, low-fat. What is the right diet? Well, if you have a condition like celiac, or you have diabetes or heart disease, or you have irritable bowel, or you have inflammatory bowel disease, or you're detoxing from Lyme disease, then working with our phenomenal nutritionist, Nor, she's absolutely so learned and so fantastic to work with, and she can help you navigate through diets. But I want to remind you of something that we all know about, that is just that nature has given us, and we just kind of forget about that. That's the colors of the rainbow. Okay? So we know we should eat lean proteins. We should eat good fats like avocado and nuts and olive oil, and avoid processed foods and sugars. But we kind of forget about these colors. Maybe we eat the same color all the time, or we maybe eat different colors, but we end up eating the same thing. So we want to get the variety of colors. We want to get the variety in the colors. So what do the colors mean? Example: red has lycopene, prevents cancer and heart disease. Purple and blue have anthocyanins, prevent cancer, stroke, heart disease, and are great for brain health. Orange, yellow have carotenoids and beta-carotene, good for eyes and mucous membranes. Green has carotenoids, indole, saponins, prevent cancer, help support our liver detox process. Brown and white, like garlic, has allicin, which is antiviral and antibacterial. And some of the brown foods like potatoes and bananas have high in potassium. So this is just a snapshot. What about the gut-brain axis? The brain and the gut are intricately connected. We have 100 billion neurons in our brain, and we have 500 billion neurons in our gut, and they're connected. Whatever goes on in our brain affects our gut. And whatever goes on in our gut, we have inflammation here, we've got inflammation here. We're also connected by the vagus nerve. This is a long cranial nerve, so this is just a great demonstration of how our gut and brain are connected through an axis. Example: serotonin and GABA, two feel-good neurotransmitters in the brain, are also made in the gut. So the digestive system is covered by one single layer, and these cells have cilia. They're hair-like protrusions that increase the surface area of the gut, allowing nutrients to be absorbed. If we have inflammation in our gut, those cilia become blunted, so we have decrease of nutrients. We can also have leaky gut, gapping between the cells. Large proteins and toxins are absorbed, like lipopolysaccharides, and this goes into the bloodstream, sets up total body inflammation, and increases our risk of autoimmune disorders. So we can test here for gut health. We have several different tests, and we may be adding one that is actually a stool study looking at DNA of the microbiome, because of the bacteria in the gut that are so essential for health. And then using artificial intelligence, it tells you what foods you need to eat to improve your microbiome. So that's exciting. So whenever we eat, we have to think what we're putting in our mouth. Is it nurturing? Is it life-giving? Now, if we choose to indulge, that's fine, but just be mindful about it. This becomes a habit, which is a good habit. So Dr. Gary wrote a book called Total Recovery, and his book was based on brain inflammation associated with chronic illness. And the research was about microglia, which are these cells in the brain that are part of the immune system and they keep our brain clean. But if we suffer from trauma, it could be physical trauma, mental trauma, infections, environmental toxins, even sleep apnea, these microglia can get upregulated and excrete inflammatory factors and inflame our brain. So we here treat many people with brain inflammation, and we use some medications. One of them is low-dose naltrexone. It's a compound in the pharmacy. But there are supplements that you can use to decrease inflammation or to be proactive. Some of these are substances that are naturally produced, like CoQ10 in the body, and glutathione is naturally produced, as well as melatonin. Vitamin D comes from the sun. It's manufactured in the skin. And some of them are supplements that just support us. They're mostly anti-inflammatory, and they're antioxidants. So antioxidants will get rid of free radicals. Free radicals damage cells. So I'm just going to by the way, this whole packet, you can go on our website and download it, and it tells about each of these brain boosters, we call them, all the research behind it, the dosages, and clinical applications. So this is available for you. If you have trouble, we have a new website. So if you have trouble finding or downloading it, just let us know and we can get it for you. But just to touch a little bit on each of them, CoQ10 is a fat-soluble substance found in the mitochondria of our cells. The mitochondria are the powerhouse of our cells. So they're involved in production of energy. And as we age, the CoQ10 can go down. There's a common medication, the statins, that lower CoQ10, so it's absolutely essential that you go on CoQ10 if you're on a statin. Curcumin is the spice, that's the pigmented spice in turmeric, and it's a very strong anti-inflammatory. Much better, you can use curcumin or turmeric as an anti-inflammatory. It's much safer than an NSAID like ibuprofen or naproxen. Ginkgo biloba is from the leaves of a tree, a ginkgo tree, and it's very good for circulation. By the way, most of these are neuroprotective, so they protect the brain from neurodegenerative diseases and from depression and anxiety. Glutathione and N-acetylcysteine are very strong antioxidants, and they help our body to detoxify. We often use glutathione and N-acetylcysteine for our Lyme patients or our patients that are recovering from mold toxicity. Melatonin is a hormone that's produced in the pineal gland that's responsible for the circadian rhythm for sleep, but it's also anti-inflammatory. Vitamin D, we get that from the sun. Vitamin D is vital, is essential for our immune system. So making sure your vitamin D levels are adequate is important to keep your immunity up, prevent illness, as well as cancer. Omega-3 fatty acids found in the fatty fish and flaxseed is very good for brain health. Quercetin is a bioflavonoid. It actually stabilizes cells that make histamine, so that lowers histamine, really good for allergies. And resveratrol, that's in red wine in the peels of the grapes, is cardioprotective and also prevents amyloid deposition associated with Alzheimer's. So what about sleep? Sleep deficit causes decreased productivity, can cause mood changes, depression, anxiety. It alters our hormones. Our growth hormone is produced when we sleep. Sleep deficit causes a depression of our immune system and affects our cardiovascular health. We need 4 to 5 deep to REM cycles of sleep per night. Adults need approximately 7 to 8 hours, and babies 16 hours, young children and teens 9 to 11 hours. How many teens really get 9 to 11 hours? So what prevents our sleep? What causes sleep deficit? Well, electronic devices is a big deal. The light bulbs, we have constant light. Medications, stress. We can have sleep latency where we have difficulty falling asleep, or we have early morning awakening. So we need good sleep hygiene, avoid electronic devices 1 to 2 hours before bed, keep the room dark and cool. The early morning awakenings, so cognitive behavior therapy for insomnia tells us that we want to associate the bed with sleep and sex, not with insomnia. So I tell my patients, if you wake up and you do not fall asleep within 10 minutes, have Plan B. Plan B, you get out of bed, you have something, you read or listen to music, you don't check your emails, and then you allow your natural circadian rhythm to take over. And the idea is to take the emotion out of it, because often when we wake up in the middle of the night, we start to get pissed off, anxious about it, and then our minds goes. But if you have this Plan B and you're not thinking about it, this works quite well. There are therapists that work with patients in cognitive behavior therapy. Now, apnea is a serious condition that absolutely must be diagnosed and treated. It's usually a partner that tells you that you're snoring or you've stopped breathing. What happens in apnea is the oxygenation drops as if it's obstructive sleep apnea. It drops and you have a partial awakening, but you have also fight and flight. All these hormones, adrenaline and cortisol shoot up, and this happens multiple times during the night. So guess what? That increases your risk for stroke and heart attack, myocardial infarction. So this must be treated and diagnosed. We can diagnose it with a home sleep study test, very easy in your own bed. And weight loss, CPAP, maybe a dental device, it must be treated. So if we want to live to 100, we need to take care of our sleep. We want to live to 100 and be vital and healthy. So these are some of the sleep supplements that I recommend for patients, either individually or in combination. 5-HTP is a precursor to melatonin, which are both precursors to serotonin. So if you're on a serotonin uptake inhibitor, you want to check with your doctor before taking those. Valerian is a nice herbal supplement for sleep, L-theanine, GABA, CBD, cannabidiol works for some people, and it's I usually recommend a full spectrum, and you just have to it's just trial and error. You have to try different brands, different delivery systems. There's creams, there's tinctures, but know that if it is full spectrum, it's going to have some THC in it. So if you get drug tested, you'll have THC in your urine. Yoga Nidra is a wonderful guided meditation that takes you to theta wave sleep, and you can use it just kind of in place of a power nap. I use it all the time. It's wonderful. And then you can use it before bed, or if you wake up in the middle of the night. There's Yoga Nidra apps. There's free Yoga Nidra on YouTube. You can just Google it. And then we talked about cognitive behavior therapy for insomnia. Exercise, sweating. We've known for thousands of years the benefit of sweating. So it's a recent study of New York City fire workers. They tested the sweat. They found bisphenol A, BPA, and flame retardant in their sweat. We know that sweat will get rid of cadmium, lead, mercury, and we often recommend saunas for our patients that are detoxing from Lyme or from mold toxin, mycotoxin. But the best way to sweat is to exercise. So I do recommend when you exercise, break a sweat. I'm a big fan of activity monitors. I think we should know how many steps we're taking. We should know what our heart rate is when we exercise. We should know our resting heart rate. We should know calories burned during activity. I'm a little obsessive when I do my metabolic conditioning and weight class. I have my watch, and then I have another heart monitor that's up on a screen, and everybody else is doing it too, and we're all obsessed, and it's great. It's great. We motivate each other. If you belong to a gym and they have available cardiometabolic assessment, where you get on an aerobic machine with a mask and they measure volume of oxygen or VO2, and they can also determine like what your heart rate zone would be for burning fat or burning carbohydrates. That would be really useful to know that data. They also, usually many gyms have good scales that measure your percentage of body fat and percentage of lean muscle mass, which is better than just weight. So again, data is good. Lots of studies show that exercise increases brain-derived neurotrophic factor, which is a fertilizer for the brain. It improves memory, enhances learning, increases resistance to insult, improves brain plasticity, which is the ability to change your brain with your thoughts and emotions in a positive way. I recommend to my patients the triad of resistance or weight training, cardio, and probably the best type of cardio is high-intensity interval training, where you get your heart rate up for a period of time high and then have recovery, immediate recovery. And there's all sorts of different ways you can do that. But there was a study that showed that HIIT was better, improved memory better than just moderate aerobic exercise in older individuals. The third part of the triad is yoga, and I can put it with meditation. Yoga is very multidimensional. Yoga takes you through every joint, through every range of motion. It works on balance, and falls in older individuals causes high mortality, so if you have good balance, we're not going to fall. It also, Dr. Lauren Fishman did an international study using 12 yoga postures a day, standing, reversed osteoporosis. Yoga also uses pranayama, which is the breathing techniques. We know that deep breathing, different types of breathing, actually induce heart rate variability, which is a reflection of health. And our therapist here, Jody, wonderful therapist, I think she's here. Anyway, she works with our patients doing heart math, is to show how breathing techniques will improve heart rate variability. In addition, yoga is a moving meditation, but it's also seated meditation and meditation in general. There's tons of research on meditation improving brain plasticity. So exercise is a really important part of our healthy aging. Now we'll move on to what we can do for you. Okay. So from the beginning of the practice, or at least I think it's the beginning, we've been doing IV vitamins, and intravenous vitamins are magnesium, B complex, vitamin C, glutathione, separate or in combination. So these are all minerals and vitamins that help support our liver detox process. They boost our immune system. They help our cells work better. Great for fatigue, for pain, for headaches, for improving athletic performance. Glutathione we use for traumatic brain injury concussions. The high-dose vitamin C for cancer treatments. Our newest addition is NAD, intravenous NAD. Okay. So this is a mouthful. NAD stands for nicotinamide adenine dinucleotide. It's a naturally occurring coenzyme that's found in every cell of our body, and it's intricately involved in cellular metabolism and DNA repair. So we have these proteins called sirtuins. We know there's 7 sirtuins. These proteins are called longevity proteins. Okay? Sirtuins are dependent on NAD. So we need that NAD to make our search ones. For example, SIRT1 is found in the hippocampus. The hippocampus is part of in the brain that's responsible for emotional memory. And so it improves memory, also protects against amyloid deposition. The benefits of NAD, of course, include it reduces inflammation, repairs DNA, improves energy, pain, sleep, cognitive function, and athletic performance. So our patients really, they really report remarkable results with this. If you're not a patient here, you can just schedule like a very short intake visit with us, and then you're free to get either IV vitamins or NAD. Let's start with testosterone in men. So in men, testosterone peaks around the 20s, and then it starts to decline. And some men don't notice much of a difference, they're fine. But there are many men who complain of depression, disturbed sleep, decreased muscle mass, increased body fat, low sex drive, and difficulty with erections. So testosterone can be tested, blood test, morning blood test. I usually do two to just verify if it's low. And it can be treated with Clomid, which stimulates the endogenous testosterone. So the male his own testosterone can be elevated with Clomid, or testosterone can be replaced. So it's not given orally because it can damage the liver, but we usually start with creams or gels or patches, but can use injections. And then our Dr. Dan, who's somewhere around here, he does testosterone pellets, and that is replaced every few months or reinserted every few months, so it gives a constant dose of testosterone. Well, testosterone, women have testosterone too, and guess what? Low testosterone causes fatigue, muscle weakness, reduced sex drive, weight gain, fertility issues, vaginal dryness, and loss of bone density. So every year, the North American Menopause Society, American Society for Reproductive Medicine, and Endocrine Society look at all the research regarding hormone therapy, including estrogen, progesterone, and testosterone, and they come out with a statement based on all that research. The latest statement was hormone therapy plays an important role managing symptoms for healthy women in menopause and 10 years beyond. So I very safely can offer hormone replacement for men and women, depending on the person's risks. But everyone does really well with this. So, we all know the benefits of healthy sex. Improves relationships. It actually improves the immune system. In men, it decreases prostate cancer, reduces depression, and induces better sleep. Causes of sexual dysfunction in men can be anything from hormones, medications. There are medications like antidepressants or beta blockers, diabetes, atherosclerosis can cause sexual dysfunction. In women, the same. Stress, the same. Women, stress, hormones, medications, but also women who have given birth, and especially have given birth multiple times. There's actually a change in the anatomy of the vaginal canal, and there's a decrease in sensation. So one of the tools in our toolbox is called the O shot. And there's also, by the way, the P shot. I don't want to leave the men out. That is available, and it would be very easy for me to get certified to do that as well. But the O shot is basically platelet-rich plasma. We've had platelet-rich plasma around for a long time in the orthopedic world. Basically, your blood is drawn, blood is spun down, the platelets are isolated in the plasma, and it's injected for orthopedics, it's injected into a joint or tendon to repair. Now it's being used for a number of other reasons. And so they found that these platelets have very rich growth factors, so they improve the circulation, they improve the nerve function. And for the O shot, basically it's in the vaginal area, a couple different shots, different areas. It is painless. I use a topical anesthesia and a little bit of a lidocaine injection.
And what is it doing?
So we're gonna go over that. So there was a pilot study, 2017 study of 68 women, Brazilian clinic, that showed that PRP OSHOT improved overactive bladder, urinary incontinence, lubrication, arousal, pain, or anorgasm. So these are the indications for the OSHOT. The founder of the OSHOT, his name is Dr. Charles Reynolds, he encourages the providers to enroll patients in studies. This is not big pharma, so it's hard to get money to study, to do big studies on this. And I have enrolled anonymously my patients. They've volunteered to enroll so that we can keep track of the effects of this. So lastly, the last slide here, this is the House of Optimal Health. So the things in the red are things that can undermine your optimal health. Drop in hormones, high cholesterol, high blood pressure, C-reactive protein indicative of inflammation, high insulin and high glucose of diabetes, poor kidney function, low vitamin D. So these are things that we can test for and we can treat. And in the green, these are the things that are the current research and uses for age reversal, okay? So for example, senolytics. Mostly they're using cancer drugs, and what they have found that these drugs actually kill off these cells called senescent cells. So senescent cells are cells that stop functioning, and they start to recruit other cells to stop functioning. And they're also called zombie cells. So these senolytics actually get rid of the senescent cells. We don't want those zombie cells around. The mTOR inhibitors also work on senescent cells, and there's some other mechanisms that work to extend lifespan. These are also some cancer drugs, some drugs that have been used for transplant, to prevent rejection of transplant. But there's an mTOR inhibitor that we use all the time, and that's metformin or glucophage that we use for diabetes. And Dr. Gary's had more experience. He's tried it on many of his patients, and he's had some very good effects with it. NED we talked about. There's some research on very young plasma, where you get a young person to donate their plasma, get injected with it. That's up in the air, whether that's helpful. Stem cells, we do also, exosomes are produced by stem cells, and they're it's called vesicles that are produced by the stem cells, and they have all the growth factors of the stem cells, but they're a little more refined. And Dr. Dan, I don't know if he's still here. Yeah, there he is. He does these things, stem cells, exosomes. So he's a guy. So that's that. So we've gone over what you can do for yourself to have optimum health, to live to 100 and be vital and strong, and through the things that we talked about, and then what we can do for you here. And I'm going to take a few questions before I pass the baton over to Rebecca. Yes.
Yeah, I guess one of the hard problems in anti-aging is the clinical trials take forever. And so if one had something like an epigenetic clock, one could measure changes on it to see how you're aging. Are you going forward or reversing? How close is that to being practical?
Want to answer that?
I can. So there's a lot of work being done on that. Specifically, they're looking at latent telomeres at the moment. So telomeres is little tails at the bottom of DNA, and basically they shorten as we get older. And so you can actually look at telomeres and determine your biologic age. And more importantly, we can't do it now clinically. But what we do is we take what we've seen in the lab with things that we know in AD, for instance, that increase telomere length, and use it here. So we're simply transposing stuff that we know from the bench, the lab studies that we do, and being able to use that to increase telomere length. Exercise, increase telomere length. Proper sleep, increases telomere lengths. Proper diets, increase telomere lengths. Okay, so there's a lot that will actually slow that biologic clock. Meditation increases telomere lengths. So, you want to be looking at this stuff. Probably, we don't know yet, we've got some early data looking at the exosomes. The exosomes are, as Dr. Lisa was saying, these anti-inflammatory things. We can actually inject those IV. They cross the blood-brain barrier. And they also seem to allow for telomere length to occur. Very interesting data that I just learned at this conference. We're looking at AI in terms of artificial intelligence, what's going to happen in the next couple of years in medicine. They took an AI and they turned it on looking at retinal analysis. All right? The AIs turn around and say, oh, this is a male retina, this is a female retina. Now, the ophthalmologists are all going, what do you mean? Well, the AI is actually correct to 100%. So it's able to bring in a bunch of data that we didn't even know was there to make that distinction. Well, what else can it do? It can predict your age within 6 years. Your biologic age. So that's coming down through a simple retina scan. That's coming down. There's also a really interesting trick on all this is that while the AIs can tell us that piece of information, they can't tell us how they tell it. So we don't know how they know that.
So Gary, just to be clear, you're saying that we can stop the shortening of the telomeres, or we can actually lengthen those that have been shortened?
We can stop and reverse them.
Okay.
Okay? And these mTOR inhibitors that Dr. Lisa was talking about. So we've got this whole anti-aging crew who's been guinea pigging themselves on metformin and rapamycin. Low dose. Now, rapamycin in particular is an agent, Dr. Lisa said, to stop the rejection of organs that we transplant. It's also used as a chemotherapy agent. Nasty side effects, lots of them. However, we use a little tiny dose, about 5 milligrams a week. It looks like it'll actually slow. So what mTOR is all about the creation of antibodies in the body. Okay, so it slows the whole inflammatory process. And so the mTORs, rapamycin, looks like it can slow the aging process, the reduction of inflammation in the body. Okay, metformin does the same thing. I've got a number of patients who have an autoimmune process going on in their bodies as a result of infections. How do we shut that down? We use IVIG, which is very expensive, but you can also use metformin, which is very cheap. And the anti-aging crew is all using this. It's reducing inflammation. One of the other discussions we had this last week in San Diego is what is Alzheimer's? All right? Alzheimer's is not these beta tangles. Now, there's some controversy in this, but there's all these beta tangles that go on in Alzheimer's, okay? Except that we have a group of people who have lots of beta tangles in their brain, okay? Tau fibers. Except they don't have Alzheimer's. Why is that? The answer is inflammation. If you see lots of microglial activation going on, then you get Alzheimer's in addition to the beta tangles. If you do not have microglial activation, I don't care how many beta tau tangles you have, you don't develop Alzheimer's.
I've read that there's research that suggests that Alzheimer's is actually diabetes 3. Is that
so? There is a subcategory of Alzheimer's, which is a type 3 diabetes. We actually don't know how to diagnose that, but we can treat it. So you can actually deliver insulin into the brain, because insulin doesn't readily cross the blood-brain barrier, but we can deliver it through a special nebulizer, $5,000 toy at the moment. But you buy it, and it will actually nebulize the insulin in small enough particles and high enough up to be absorbed by the neurofibrils in the cribriform plate and be absorbed into the brain. Okay, it's not opinion. There's actually very good research on this stuff from a number of our institutions. University of Washington in particular has done a lot of great work on this. So we know this stuff gets absorbed and we know it can make a difference. So yes, type 3 diabetes is one type of Alzheimer's subtype.
Yeah. I was wondering about the microdoses that also for lithium, for example,
Yep.
are supposed to be good for the brain.
Mm-hmm.
And they remove the action of electrolytes, cleaning away waste proteins.
Right.
What is it about microdoses that we're missing? If we do a drug trial, we look at the highest dose that doesn't cause adverse effects, but there may be things well below that where it's beneficial. You know,
So
for the naltrexone, and also being used
Exactly.
in cancer treatment, but the microdose.
So, low-dose naltrexone is an excellent example. We have a lot of experience with it. I know the mechanism of action of low-dose naltrexone. So what happens is at the higher dose of naltrexone is the drug we use to reverse the occurrence of fatal overdose from narcotic. Okay? However, if you use 4.5 milligrams or below, and we can go as low as 0.25 milligrams, which you have to have compounded, it actually reduces microglial activity. Microglia is the innate immune system and central nervous system inflammation. It also will help stop Crohn's disease from being active in other autoimmune processes. So I'm not sure what the mechanism is in terms of how it shuts down the autoimmune processes, but you're absolutely correct in using its microdoses. Lithium, in and of itself, is an anti-inflammatory in the central nervous system. So you don't even have to use microdoses, though you can. Lithium orotate in 5 milligram doses is different than the lithium carbonate that we use for treatment of bipolar disease. But you can still use 125 milligrams of lithium carbonate. It's a small enough dose to be anti-inflammatory in the central nervous system. Found it very effective for that. Also, the SSRIs, the selective serotonin inhibitors, the way they work is they're anti-inflammatory. That's why it takes 2 weeks to a month to really see the effectiveness of it. But I need to let
Yes.
Rebecca go because I'm
Anybody have any other questions?
One quick one. You said that you were recommending using hormone replacement therapy in women 10 years out from menopause. What about 20 years out? What about?
Well, I do have women that continue on. It's really a choice. We work together to decide, how long we want to do
Okay,
it.
but
I'm
any
not gonna be like-
adverse?
But,
any reason not to?
there are, we do have ways to determine how you're metabolizing it.
Right.
There's actually, blood tests and urine tests that can determine if you're metabolizing it in a healthy manner. There's actually some of the supplements I talked about, magnesium and the B complexes and some other things like Indol 3C help the metabolism of estrogen in a positive way. So it depends on the person. Can't be across the board that, that's it, you can't have any more hormones. So it's really an individual. And the other thing is that I use delivery systems that are much safer than what were in the Women's Health Initiative study, which was Premarin from pregnant mare's urine,
Right.
oral. We use transdermal creams and that type of thing, patches, gels.
Thank you.
Thank you, Grace.
Sure.
Okay, great, you're on. Oh, yes.